Hi, I'd like to talk about abdominal bloating. Bloating is a very commonly seen symptom. It's a sensation of fullness in the abdomen, and sometimes it can be seen with the eyes. So patients are distended, and usually, more often than not, we see it in women. So there can be a visible abdominal enlargement as well. It's a sensation of tightness or discomfort, usually after meals. The good news, however, with bloating is that many times it's nothing to get concerned about. It's not dangerous, but certainly it can affect our quality of life. It's a buildup of gas. Okay, so if we have a problem, let's say, with lactose intolerance, or if we have a problems with digesting fermentable carbohydrates, there's going to be an increase in the gas production that the body cannot eliminate. And we get these symptoms of bloating. We see it often with patients with irritable bowel syndrome. Also, with symptoms of constipation. So if the bowel is unable to evacuate the stool, that also is going to give us abdominal distension. Now, you look at rather simple things at first. Are we eating too fast? Are we eating fatty, greasy foods? Are we eating late in the evening? Is there smoking or alcohol, which certainly are factors that increase our symptoms of bloating. But aside from these, it can also be the first warning of a disease like with SIBO, small intestinal bacterial overgrowth, where there's actually a buildup of bacteria, and this also causes a fair degree of gas in our abdomen. So the message here is that if the bloating is not managed with simple dietary manipulation, by stopping smoking and alcohol, then it needs to be investigated further. Especially if there's any red flags, like for example, if it wakes you up late at night, especially if it's a new symptom that happens after the age of 45 to 50. If in the blood test there's any decrease in your iron or if in your hemoglobin. If it's associated with any rectal bleeding or change in the color of your stools, for example, then certainly this needs further investigation, usually with an upper endoscopy, gastroscopic examination, or with a colonoscopy, because you need to rule out more important, more dangerous findings. So the message here is this: bloating is not a disease, it is a symptom. Okay? We deal with it, first of all, with dietary manipulation, sometimes what we call a FODMAP diet, where we give you a decrease in fermentable carbohydrates. But if, despite all of this, your symptoms persist, or if you have any other warning symptoms that we've identified above, and then it needs further investigation with extensive blood tests and with endoscopy. Thank you.